Hello and welcome. My name is Morgan Lloyd and this is my instructional method presentation on case studies. Some of you may or may not have used these before as a learning tool, but we will take a look at why they're used, what the best way to use them is, and how you will be able to use case studies in the future. I added this picture of these students that are excited and eager to learn because I'm sure this is how you are all looking at home, getting ready to watch this video. So what is a case study? A case study is a teaching tool that presents a scenario. Think of this scenario as a chunk of reality that is brought into a learning environment and then put on the top of your paper. These scenarios for healthcare setting can often be maybe patients that you're getting as new admissions, and then they're followed by some questions aiming at what you might do first for this patient. And then another scenario could be a list of patients that you just got after report, and then the questions afterwards might aim at who you see first. And then a third option of what could be used in healthcare is that a patient is brought into the emergency department. No one really knows what's going on, so you assess what is going on with the patient, what could be done, and what tests might be done for this patient. So case studies are typically set up like this one that you see here on the right, this picture, a paragraph set up on the top of the page explaining the scenario and then the questions down below to follow. And case studies could be anywhere from this one paragraph example that you see here on the right, or they could be pages and pages long. They can be real examples that are actually happening or happened, or they could be made up scenarios for the perfect situation that you're trying to portray. Case studies typically are used in a way where there's 3 different steps. I'm going to go over the steps. The first one is individual preparation. Individual preparation is when the learner or the student reads the case and prepare their response. The learner can apply different problem-solving skills depending on the topic. For example, they could use nursing process. At this point, the learner can also gather additional information that may be needed in possibly textbooks or found on the web. And this is when the student is planning their plan of action in their head and answering the questions that are set with the scenario on their own. Then the next step is step 2, a small group work. At this stage, the learners work together in small groups to discuss answers and opinions on the case. They can challenge each other to justify their own answers or point out different details that the other learners may or may not have seen or recognized. This helps develop communication skills and problem-solving skills between learners. Step 3 is a large group discussion. The large group could be a whole class in a class setting, or it can be the whole group that's at work, whoever you're working with. And then the individuals share what the small groups have came to conclude and the ideas that they came up with. This can open up into a debate sometimes, and the teacher is there to guide and provide answers to the questions that arise in the large group discussion. Some examples for peer case studies could be simulations. I know we use simulations in the hospital where they provide us a scenario, we go in, we use our own knowledge, we use the knowledge that's provided, and we come up with solutions. And then afterwards we debrief and see if our solutions were the right ones, the wrong ones, and then answer the questions. You can also use verbal. You could give someone a scenario. You see this type of patient, this is the symptoms they have, what would you do for the patient? Students' simulations, you can also use those. I know students use those a lot in school. And also students use paper ones. I remember in nursing school we would get a scenario of a patient, we'd answer questions, and then we'd either answer them by ourselves or in a small group, and then we'd talk about them as a class. For patient education, you could use a paper scenario for those, and you could either give them a scenario that is something of a patient that has the same diagnosis as them, or someone similar, to maybe help them answer questions of what kind of lifestyle they're going to have at home, maybe what diet they're going to need to eat, just to re-educate and kind of help them remember what they're going to need to do at home. You could also do the same thing as verbal, just give them a scenario of a patient maybe with a similar diagnosis as them, and have them answer a couple questions maybe regarding lifestyle changes that they might need to make in the future. I have this link down here at the bottom. I tried really hard. I could not figure out how to get the YouTube video in. The link is a video on an asthma case study, which could be another way to show someone a case study instead of having them read it or do a simulation. They could watch a video on a case study. It gives them a bunch of information on the patient, and then in the end it does give the answers, or you could go over the answers without watching the rest. So the learning domains for case studies, I thought definitely cognitive domain. For the knowledge part, the learner has a baseline of knowledge prior to starting the case study. And then comprehension, the learner is able to recognize and summarize information while reading the presented information. And then the application part, they apply the knowledge to be able to analyze and determine if the information presented is actually needed information and that's important to answering questions, or if it's just extra fluff added in that's a distractor. The learner is then able to evaluate their knowledge with the other learners, and they're able to talk in large or small groups about it. And then I also thought the affective domain goes towards attitudes, beliefs, and values. First, they receive the information presented in the case study. Then they can organize their thoughts, the information, and prioritize the information given based on the questions that they're asked. The learner may also even start to organize thoughts while they are reading the presented information and anticipate the questions that may be asked. So why use a case study? Some pros to using a case study. First of all, it engages the learner into real life scenarios. Case studies provide a situation that the learner, they will most likely be in or will see out on the clinical floor. The nice thing is that they are able to sit down with the information, think it through without the time crunch of real life. This gives students a chance to see the situation for the first time in a safe environment. For example, they can have this crisis situation on the paper, think through the crisis situation without being in the crisis. Also, case studies help develop problem-solving skills. They also enhance critical thinking and increase communication and collaboration between peers. Some cons to case studies. Cons to case studies, it's not real life, so they're not actually in the situation. It does not always apply to similar situations like you will see in real life. Lack of insight to actual situation leading to disagreements and assumptions. Also, information can become outdated and then it will then be wrong. And then the information may bore or lack interest of the learner. So thank you. That was my presentation. I hope you all enjoyed it or at least learned something. Thank you.